Hi, my name is Terry Kuti. I am the founder and director of deepseafoundation.org. I would like to welcome you to the educational channel where we talk about various topics related to breast cancer and breast reconstruction. I'm joined today by a very special guest, Dr. Lucy De La Cruz, who is the Chief of Breast Surgery at MedStar Georgetown University Hospital in Washington, D.C. Welcome to the program, Dr. De La Cruz.
Thank you, Terry, so much for having me. This is my pleasure to be here today with you.
Yeah, what I'd like for you to tell us, because I'm very excited about, I want the viewers to understand the value of an integrative approach to your work at MedStar and all that you're doing there, so that they have this resource and they can come back to this video and know what you're doing. So take it away.
Perfect. Thank you. So, at any institution or at MedStar specifically where I'm at, we participate in something called a multidisciplinary approach to breast cancer treatment. We used to treat breast cancer, most cancers, in a very compartmentalized way. And studies showed that if we all worked in collaboration with each other, actually patients did better. So they had better quality of life after cancer. They had better survival after cancer. And that is the reason why a lot of the institutions have implemented multidisciplinary or cancer centers where they perform multidisciplinary cancer treatment. At MedStar, we work collaboratively with the medical oncologist, the radiation oncologist, the plastic surgeons, as well as with another group of support system for our patients like geneticists, social workers, physical therapists. And all of this is part of the integrated system that provides patients with a more comprehensive approach to their breast cancer treatment. How do we do that? So let's say that the patient gets diagnosed by initially the radiologist, which I forgot to mention as well. Obviously, they're on the front line of this. They get a mammogram, they get ultrasounds, and they get a biopsy. Usually the person who explains to them that they have cancer, it's either the radiologist or the person who ordered the procedure, which is usually the primary care physician or the OBGYN. Once the patient has a cancer diagnosis, usually the first person they visit is us, the surgeon or the surgical oncologist. And part of our process is to really put them, I always tell them that I write out the plan, which is their roadmap of what their cancer journey is going to look like. And I'm a fair believer that the moment that they get this diagnosis, their experience and their journey begins. And I always focus on making sure that journey always has a positive outlook. Because we do understand the impact of having a negative experience from the beginning or even along the way in their quality of life. So, when I see the patient in my office, I try to be pretty comprehensive of what to expect from each of these specialists that they're going to be visiting and each of the people that are going to be participating in their care. So when we meet with the patient, and obviously we tell them about their diagnosis, we explain them, with detail what their cancer is and how it's going to, impact them surgically, not only surgically, but also as far as their further treatment. I usually try to tell them kind of what to expect so that there's no surprises along the way. And I feel like that's one of the things that causes the most fear for patients, having the unknown.
Yes.
So when you sit down with them and you tell them this is going to be your road trip and this is how long that road trip and that journey is going to take, there's a sense of, okay, I have empowerment. You have given me my map. I'm going to take ownership of this and I'm going to push forward. And I kind of incorporate who are the people that are going to kind of be there along the way. Usually they used to say that the surgeon was the captain of the ship, but there's really not that sense of captain of the ship. We're all rowing on the same direction. That's really what I try to tell them. We're all here. We're sitting in our own spot and we're rowing all so that we can get you through the tunnel and into the light. So that is definitely one of the things that I think that our institution really works really well at. We have a great team of radiologists, plastic surgeons, radiation oncologists, medical oncologists, and our support staff also. That's incredible. And one person that a lot of people don't really realize the importance of their presence in any program is the nurse navigator. The nurse navigator, it's interesting because I always think about the nurse navigator as the person on the top of the boat that tells you where land is. That's the nurse navigator on your journey. They're the ones that you call when sometimes you don't understand a couple of things or you're kind of lost along the way. They put you back on track. And so that's usually how, we treat breast cancer at our institution. And that's how it should be in most places. And if you're not in that place where you have that kind of treatment, you should look for that. There's a lot of cancer centers now all over the United States that are really focusing their approach into a multidisciplinary, process.
Yeah, the analogy that you made is just hitting a real note with me, talking about this as a journey and that the patient and all of this coordinated care is working together to drive the outcomes for the patient. So I love that analogy, Dr. De La Cruz. One of the things that I'm very excited about too, that I know about you, is that you are a fluent Spanish speaker. And at the foundation, we are so interested in reaching a broader audience, not just the English-speaking language people. And so talk to us just a little bit about the benefit of for your patients with you being a Spanish speaker as well.
Thank you so much. Well, yes, I am obviously, I was born in Cuba and Spanish is my first language. I also speak Portuguese, which was my second language. But one of the things that I have been told and, by my patients is that there is a sense of relief when one can communicate in a time of unknown and fear with someone who is a provider who speaks their own language.
Yes.
It's not to say that the interpreters don't do a great job. It's almost as if there is that barrier of the interpreter having to express their emotions and their concerns in another language. And that even that time frame of even a minute for them is still increases. It may increase their anxiety.
Mm-hmm.
It may increase that maybe their message is not coming across. And also, they say like when we hear the reply in English and then we have to wait, sometimes there's a lot, they feel that there's something lost in translation. So, I'm very fortunate to be able to be trilingual. I've been lucky enough to be in institutions where I'm able to provide service to a large Spanish speaking community because I've been in places where there's a big community of Spanish speakers that come to me. And so I feel like I'm doing double duty in that sense of the good deeds of being able to provide them with that sense of relief that they can openly express themselves. And there's a lot of mannerisms and things that we say in Spanish to other Spanish speakers that I really can't translate to English. So I can tell them, I understand what you're saying. I get it. I get where you're coming from. There's also the cultural aspect of it, not to say that other cultures are not warm, but the Spanish culture and the Hispanic culture are, we're really warm. We're about hugging. We're about coming in contact. And I feel that patients kind of limit themselves to expressing their emotions to their provider when they have someone who's translating for them. Again, I'm not taking away from the fact that the translators and being in that position is the wrong thing to do. Mm-hmm. But if you can find somebody who speaks your language, it's definitely, I have a mom who speaks somehow a little bit of English. She's very, she doesn't speak that well English. And when I go to the doctor, I go with her. I'm her translator. And sometimes, I understand her kind of wanting to say more. And I kind of sometimes, being more limited in the English, like I try to limit what she's trying to say just to be more direct. Not to, take away from her experience, but really to be more, direct with a physician. Spanish, if she would have had someone who was in Spanish, she would be more open and she would feel more comfortable, I think, for her own experience. And I've been told this over and over again by patients when they say, oh my God, doctor, you speak Spanish. This is so great. My biggest fear was to come here and have someone who, I wouldn't be able to just openly express myself on my concerns. And again, I think I deal with patients who I don't speak their language, and I use a translator, and I usually try to do my best to understand them and to let them know that I'm there for them no matter what, and that should not be a barrier to their care.
Well, I'm very excited about this because as a trained ESL teacher who does not speak any other languages, but understands the power of communication, and the word that you used really hit a note with me, empowering the patients. So being able to provide this for a Spanish-speaking audience is very important, because we have to learn terms even in any language. When we're diagnosed with breast cancer, the terms that we have to learn are overwhelming. So I look forward, Dr. De La Cruz, to doing some more work with you in the future. And I'm very glad to hear about all of this work that you're doing at MedStar Georgetown as the new chief of breast surgery there. I just think this is going to be a very powerful video for patients, not only if they're seeking an opportunity perhaps to come see you, but to listen to what you just said and to ask the questions in other facilities, so that, again, like you said, they're empowered by the education and information they get with integrative care, but also all of this interesting conversation that you just had about communication through language. So I really want to thank you for joining us today. And again, I look forward to doing more work with you in the future.
Thank you, Terry. Likewise, I'm always here for you.
All right. We'll talk soon. Thank you so much.
All right. Thank you so much.